Hello, my name is Jackie Maimin, and welcome to the third episode of the FIP CPD Bite series on pediatric pain and fever management. In the previous episode, we explored managing pain and fever across different pediatric age groups. In this episode, we'll focus on the challenges pharmacists face during the transition from managing fever in infants and toddlers to managing pain in older children and teenagers. By the end of this video, you should be able to illustrate the pharmacist's role in supporting care during age group transitions and in educating parents or caregivers. Learn when to advise seeking medical attention for children's pain or fever, and present practical strategies and case scenarios for pain and fever management in different age groups within the pharmacy setting. The transition from managing fever in infants and toddlers to managing pain in older children and teenagers comes with several challenges, both for the pharmacist and the parent or caregiver. There are differences in pharmacokinetics and pharmacodynamics, where there are age-related variations in the manner infants versus teenagers respond to and metabolize medicines. Communication and education is primarily aimed at parents with small children, but as the child grows older and approaches adolescence, pharmacists need to begin addressing the child directly. Children's attitudes towards medicines change as they grow older, and the parents are going to encounter statements such as, "I don't want baby medicine anymore. I want grown-up medicines. I hate the taste. The tablets are too big." The pharmacist will need to consider psychosocial and behavioral changes and adapt the treatment in terms of condition-specific factors, as well as formulation and administration considerations. In order to support the parent, it is vital that you include the older child in an age-appropriate conversation to try and address these challenges. The approach should foster collaboration, provide reassurance, build trust, and encourage independence and responsibility. The issues of consent and confidentiality become more pronounced in an adolescent, and pharmacists need to navigate these issues with integrity and care, particularly when dealing with sensitive health matters. The age transition also requires lifestyle considerations when managing pain and fever, both as complementary strategies to pharmacological treatments and in some cases as standalone interventions. Hydration is important across all age groups, but it is critical in a baby with a fever. Rest, sleep, and proper nutrition support healthy immune systems and the way the body perceives pain. Pharmacists should counsel on temperature regulation through appropriate dressing, so not overdressing or underdressing, and advise against tepid sponging to reduce fevers, as there's no significant lasting effect on inflammation and therefore the fever. Knowing how to manage pain and fever at home and when to seek medical attention is very important to ensure the safety and well-being of a sick child. As a pharmacist, you also need to be aware of and be able to give guidance regarding red flags that necessitate referral. These can be found in CPD Bite Episode 1, Understanding Pediatric Pain and Fever, which provides guidance on when referral is necessary for pediatric pain and fever. Moreover, as you may have watched in our second episode on managing pain and fever, not all fevers require treatment, and you can also see which conditions require treatment in our CPD Bite second episode. But it's important to note, any fever over 40 degrees Celsius or above, regardless of age, should be referred. And in areas where malaria is endemic, a child presenting with fever should be tested for malaria. It's also important to note that the level of fever is not an accurate, independent measure of the severity of illness in febrile children and cannot be used to distinguish between bacterial and viral infections. Let's have a look at a few case scenarios now. So the first one, parents come into the pharmacy with their 6-month-old baby who's been experiencing a fever of about 38.7 degrees Celsius for the past 12 hours. The baby's been irritable and has not been feeding well. So ask about symptoms, including the duration of fever and the baby's feeding status. You can recommend paracetamol syrup every 4 to 6 hours as required to manage the fever. However, if the child appears distressed, you can also advise the parent to consider giving ibuprofen suspension 3 times a day, both following weight-appropriate dosing guidelines. Ensure that parents understand the risks and benefits of both paracetamol and ibuprofen so that they can make an informed decision about which medication to administer to their child. Demonstrate the use of a syringe to draw up the correct dose and how to administer the medication. Advise the parent to keep the child, the baby, well hydrated and to stick to the correct dosing intervals, but not to wake a sleeping child to administer a dose. As far as follow-up goes, they should monitor the temperature and the symptoms and remind the parents of the red flags for referral. The parent will leave feeling reassured and with clear instructions on how to manage the fever and, most importantly, when to seek further medical help. Our second scenario, a parent comes into the pharmacy with a 6-year-old child who's been complaining of ear pain for the past few hours, especially when lying down. The child has a mild fever of 38.2 degrees Celsius, and it's very obvious wants to participate in the discussion. With age-appropriate questions, ask the child and the parent about onset of pain, whether there's a recent history of any cold or respiratory symptoms, and if there's any discharge from the ear. Check for allergies, and also ask about preference of formulation. Recommend ibuprofen in an appropriate dosage form to relieve the pain and reduce the fever at the correct dose based on the child's age and weight. Add that warm compresses to the ear will assist with alleviating that ear pain, and reassure the child that the medicine doesn't taste too bad and that if it's taken properly, it will take the pain away. Counsel the parents on how to monitor the symptoms and remind them that if the pain persists for more than 48 hours, or if the fever worsens and there's a discharge from the ear, the child must be referred to the GP. The child and the parents will leave with a clear understanding of how to manage the ear pain and the fever at home, as well as a plan of when they need to go to the doctor. The third situation, a caregiver comes into the pharmacy with a 16-year-old teenager who has sprained an ankle during a soccer game. The teen is in pain with some swelling around the ankle. Ask the teen about the nature of the injury, the severity of the pain, and whether they can put any weight on the ankle. Check if any pain relief has already been taken, and very importantly, check preferences with regard to dosage form and if there are any allergies to medicines. Recommend and explain the RICE method, which is rest, ice, compression, elevation approach, and suggest a non-steroidal anti-inflammatory medicine such as ibuprofen to reduce the swelling, relieve the pain, and speed up recovery. Advise that ibuprofen is available in several different formulations to see if there's any preferences or difficulties with certain dosage forms. This will definitely improve adherence. Personalized care enables pharmacists to address the unique needs of each pediatric patient by tailoring communication and treatment strategies according to the child's age and developmental stage. Pharmacists often face challenges such as ensuring accurate dosing, managing different formulation preferences, overcoming resistance from young children to take medication. To tackle these challenges, it's crucial to select the right medication in the correct formulation and dosage, and to engage both the child and their parents in discussions about the treatment plan. Pharmacists can, for example, offer various medication formulations, such as syrups, tablets, and within tablets, there's chewables or dispersibles to match the child's preference. Clear and empathetic communication is vital for building trust with both the child and the parents. Additionally, appropriate follow-up can help ensure that the treatment is working effectively and that there are no issues with compliance or side effects. By focusing on these areas, personalized care, clear communication, and follow-up, pharmacists can overcome common challenges and play a vital role in managing pain and fever in children across all ages. Thank you.